Hello, everyone. And I know we're getting closer to lunch, so hopefully there's still some energy left. I'm very excited today to be with you all and maybe taking a step back to think about the groups that we serve when we're looking for healthcare innovation and how we at Manulife think about that as we look at ESG, as we look at health and well-being and underrepresented groups. So earlier this year, we have announced our ESG framework, and Manulife is both an insurer but also a wealth manager, and we have decided that these are the three pillars that we are looking at from an ESG perspective. The first, empowering sustained health and well-being. The second, driving inclusive economic opportunities. And the third, accelerating a sustainable future. I won't talk too much today about the third category. That's more in our investment portfolio. We own forests and how we make sure that our real estate portfolio is pulled together. But the first two are very close to my heart because health and well-being translate throughout Asia Pacific, and also looking for where we can make a difference with groups that today don't necessarily have access to insurance cover and health cover, and how we connect those two together. So we, Manulife, we currently operate in 13 different markets in Asia. We are a Canadian company, and we've been around a long time. So this year, it's our 125th year in China. And our most recent expansions were India and Myanmar, which were in 2019. And so we're here. Our customers are your customers, our agents, our employees. We feel that we really need to look a little bit deeper and make sure we are investing in our partners. Now, we have both our insurance business, which is what I am a part of, but also our wealth and asset management. In Hong Kong, we have both. We have our MPF business as well as the insurance. But how do we take this further? And what have we already done in some places to make this difference? And I wanted to give a couple of examples. Typically right now, if you have diabetes, it is very difficult to purchase insurance on your own. Life insurance, health insurance, that's ticked. That's a pre-existing condition. Sorry, you are not standard risk. Well, in our North American businesses, we've pivoted that. We use behavioral health insurance, tracking your exercise, your movement, your steps, to then say, you have got your diabetes under control. We can offer insurance. We can provide that because we understand that risk. Shifting gears, we also have to think about groups that historically have not had availability because of their sexual orientation. In Hong Kong this year in June, we announced that same-sex and opposite-sex partners can also be beneficiaries of our policies. Let's go to another country. In the Philippines, we now are providing coverage for people with HIV. So you're HIV positive? That's okay. We can provide insurance solutions. And so we've been thinking about how we redefine what we as an insurer should be providing. And that's part of why I'm here today. It's not just insurance. It's the whole proposition, including what services also need to be included if you are our customer. And that is really the magic for me as we move forward. So that's our proposition. We sell insurance, but there has to be more. So what could these value-added services be? And how do we take them? Should they be digital? Should they be analog? How are we connecting these through? I'll give a couple of examples here. I am passionate about mental health, and I know later today there will be a speaker specifically focusing on mental health. The best solution might be to start with digital solution, to get access to people where they feel comfortable. Should that solution then be attached to an insurance product? And then should, if you need it, additional visits with a face-to-face provider or facility be included? Similarly, telemedicine was mentioned by one of the previous speakers. Where should you have access to your doctor? Where should you be able to find out about new trials or areas to treat cancer after you are diagnosed? If you have an insurance policy, you're probably going to look for it where that policy exists. So how we connect these is very, very important. I think diagnostics, so providing support after you're diagnosed, and also then providing care after you leave the hospital, to me are two areas that very much segue with what people expect from insurance, but those aren't really insurable. They're services that wrap around, and that is what we have been looking at with expanding our view on propositions. And because of the underrepresented groups, people who don't make a lot of money, people who have been discriminated because they're an ethnic minority, people who, because of their sexual orientation, have not had access to care, we can put specific value-added services into our proposition that balance the needs and risks of these new segments. And right now, our business in China is probably the most successful example of this that we have. Manulife Move is our proprietary platform, and currently our business in China, we partner with over 30 different partners to bring value-added services to our customers in the mainland China market. Right now, we are looking and expanding that to our Asia footprint from the map, because we know the same services that work here won't necessarily work there. And so we are connecting the dots and trying to figure out which is most valuable as we look forward. And we have this year also set up our own health innovation sandbox. We're about 6 months in, and I do want to caveat this. Given that we're an insurer, long-term for us is your lifetime. So we hold insurance policies 50 years, 60 years, 70 years. Short-term is something less than 5 years. So I know that's long in the startup world, but short-term for us is less than 5 years. And we are trying to make sure that we're getting that innovation into our decision-making process with our propositions and with the insurance products we wrap around them. We don't want to be afraid of taking on some risk that will become normal in a year or two. And we do have 3 propositions that have already gone through, that we, one of which has already launched. We, in China, are focusing on the elderly segment. Typically, if you're over 50, that's a real tough time to get insurance. So we're combining value-added services with a base insurance plan. That would be something that maybe I would purchase from my parents, as an example. Then in Vietnam, we are looking at how we can provide higher valued insurance for lower price. So we are targeting exactly which conditions we want to cover and also connecting it with the Move ecosystem to make sure that we're looking for healthier risks. And finally, in the Philippines, we are designing products for people who've never bought insurance before, and they want to see what's the value now. So what services are we connecting with those different areas, and how do we introduce people who've not had the ability to have insurance to connect them through? So it's been really great. I wasn't sure how this would be received when we started. We are very traditional, but I agree with some of the previous speakers. The pandemic really helped us all think outside of the box, think more digitally and also in a more analog way. And I think these are areas that, hey, if we as an insurer who's been around 125 years can start to think differently, let's continue that discussion as we determine how we make every day better for our customers. So I thank you very much for the opportunity today. I'm really excited with the passion and innovation that I have seen, and I hope that maybe we'll partner in a Sandbox in some way in the future. So thank you very much.